Good morning friends, you are most welcome to Think Eyes channel. Today we are going to discuss practicing anthropology, in which we are going to discuss Unit 4 Applied Aspect and Public Health. Let us begin the topic. Contents are first introduction, in which we will discuss definition and history of public health, concept of community health, differences between public health and clinical health profession, relationship between anthropology and public health, theoretical and methodological contributions. Second, anthropological design of public health intervention, in which we will discuss an example of anthropological intervention, role of anthropologist as community recommends. Third, anthropological evaluations in public health initiatives, in which we will discuss qualitative research methods, difference between quantitative and qualitative research approaches, types of qualitative data collection techniques, example of qualitative evaluations of public health initiatives. 4. Anthropological critiques of public health policies. At the last, we will discuss the summary. Learning objectives are, by the end of this unit, you should be able to understand the important role of anthropology in public health interventions, understand qualitative research methods in anthropology and their applications, how anthropologists can do advocacy in formulating public health policies, and know about application of anthropological knowledge and practices and the scope of applied and practicing anthropology. Introduction. The applications of anthropological knowledge cover diverse fields, and with this vast knowledge gathered through anthropological research, it has the potential for improving the human conditions. Anthropologists are uniquely qualified because of their ethnographic training, not only to gather information from the communities on the receiving end of government policies of interventions and change, but also to act as cultural brokers between policymakers and target populations, many of whom are traditionally powerless groups that have little access to power centers where such policies are made. Anthropologists are often identified with the study of primitive cultures or remote cultures that seems at first glance to have little to do with the problems of contemporary world. But in reality, anthropologists have always tried to contribute through their anthropological knowledge and fill the vacuum between the policymakers and the target communities. In this lesson, we will try to learn in details how anthropologists provide intellectual support in the domain of public health. Singer et al. 2007. Let us discuss the definition and history of public health. Public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. Winslow 1920. Winslow 1920. As such, public health focuses on health of population or community in which there is no definite number of population covered. It may be a small set of community or a big nation, like in case of a pandemic, depending on the gravity of problem. Public health, in other words, is the organized endeavor to improve the health of communities rather than individuals. While combating disease or illness, public health professionals do not depend on a set of knowledge, but they handle the problems with a different approach, relying more on the social science anthropological approach. Such approaches are culturally appropriate, sustainable, and acceptable to the communities for improving their health behaviors. There are several factors influencing the community health behavior, like social, cultural, biological, and environmental. To understand this dynamic process, the public health practice uses a large body of skills and knowledge for successful interventions. Therefore, the scope of public health is very wide and it undergoes changes according to the changing patterns of disease in the population. For example, in India, over the last decade, the focus Our priorities have shifted from communicable diseases to non-communicable diseases due to the rising number of incidences and changing lifestyle of communities. Concept of community health. Community health is a subdiscipline of public health and concerns with the study and betterment of the health characteristics of biological communities. While the term community can be broadly defined, community health tends to focus on geographical areas rather than people with shared characteristics. The aim of medical intervention is to improve health of a community through improving access to medical facilities to campaign of public health communications. Community health can be divided into three broad categories: primary health, primary health care, PHC, aims at interventions in the individual or family level such as immunization, family planning, use of condoms, use of mosquito nets, etc. Secondary healthcare system aims at activities which focuses on the surroundings or setting such as waterlogging in the colony, cleaning bushes, spraying insecticides to control vectors like mosquitoes, cleaning drinking water, etc. Tertiary healthcare aims at interventions that take place for advanced medical investigation and treatment such as tertiary referral hospital. This is a consultative health care process usually for inpatient, and on referral from a primary or secondary health professionals. Difference between public health and clinical health profession. Public health as a profession emerged in mid-20th century, focusing mainly on community health, whereas clinical health profession deals at individual level. Clinics or the clinicians treat the patient for a specific disease which include a wide range of illnesses, but public health professionals are more concerned about the prevalence of a particular disease in a community and try to look at the patterns through the surveillance or existing data. The public health professionals' approach is more preventive rather than curative, which is exactly opposite to clinicians' approach. Public health profession has multidisciplinary approach which includes medical professionals, anthropologists, behavioral scientists, social workers, nursing staff, etc. Clinical practitioners look at the specific individual problems in a given time frame exhaustively. But public health professionals look at the problems from a community perspective with the aim of promoting healthy behavior knowledge amongst the people so that the community as a whole lead a healthy lifestyle. The public health professionals are concerned about the entire generation or even ahead, and they also deal with the issues of human rights, social justice, etc. Whereas clinicians concentrate more on individual patients and their rights at an individual level. From an educational perspective, clinical practitioners focus on the biomedical model with more emphasis on cure than prevention, although this is shifting now. Whereas in public health, importance is more about the sociology, epidemiology, cultural anthropology, economics, and more. But in reality, both are complementary and supplementary to each other because the common concern of both the professions are disease and illness. Though there are differences in skills, differences in methods, approaches, or ethics, but in the practical aspect, these differences do not play much role compared to the common factors. Public health activities, population health assessment, prevents epidemic, protects the environment, workplaces, housing, food and water. Monitoring or monitors health status of population or health surveillance, health promotion and health protection. Disease and injury prevention, mobilizes community action, respond to disasters, assure quality, accessibility and accountability of medical care, reaches out to link high risk and hard to reach people to needed services. Researchers to develop new insights and innovative solutions leads to the development of sound health policy and planning. Sources for a healthy nation returns on inventions in public health. Executive Summary 1994 US Department of Health and Human Service Public Services.